Hi, welcome everybody to our Zoom town hall tonight. I'm Catherine Stefani, the District 2 Supervisor, and I'm so happy that we're joined tonight with Assessor Chu. Thank you so much, Carmen, for being with us tonight. And Sam Bennett, my legislative aide, will be moderating. So thank you, Sam, and thank you to my entire staff for making this possible. We want to get to as many questions as possible, but first, Assessor Chu has a presentation for us as she leads the Economic Recovery Task Force as our chair. She's going to present on that, and then we'll get into the questions that everybody sent.
Sounds good. Should I get started?
Yes, that'd be great.
Oh, okay, let me just turn on my slideshow and then I'll do a share screen. Okay. So first off, before I do the share screen, I do want to thank Supervisor Stefani for inviting me to come speak with you, and hope that we'll be able to answer as many questions as possible. And I think just for folks to know as well, we'll be making sure to make the presentation available to you, so you don't have to rush to try to jot down the information. We'll make sure that you have the presentation emailed so that you have that handy at your disposal. And then to the extent that we're not able to get to some of the questions that you asked, of course, we're going to be happy to follow up with them or get them or route them to the right places so that you can have some answers or more information about where to get that. So with that, I'm going to start sharing my screen. Hope it works. Okay. So just by way of background, I'll go very quickly here because I've actually left a few slides that I think are going to go directly to some of the pre-submitted questions, so I won't go over them through this presentation, but I want to give a little bit of grounding in terms of the work of the Economic Recovery Task Force. As you may know, the mayor, alongside with the Board of Supervisors, convened the Economic Recovery Task Force to really pull together a cross-section of businesses, community leaders, different neighborhood groups, and businesses from different sizes and different sectors to be able to inform and provide, I think, real on-the-ground experience in terms of what is necessary to try to help put San Francisco in the best place possible for economic recovery. As you can imagine, the economy is wide and varied, and there are so many different kinds of things that people do in the day-to-day lives of our businesses and residents. And so it's a very vast and large task force. We have roughly or over 100 people who are part of the task force, so it's a very, very large organization. We have so far done a lot of work to try to get out to community, but there is always more to do. We've received over 1,000 or so surveys. We have conducted 60 to 70 convened meetings. And I think that we have also identified areas or different groups where we're seeing less participation than we would want to. And so we're going to be working in the coming weeks to make sure we continue to engage communities to make sure we have a full representation of the perspectives of San Franciscans as we go forward. In terms of the task force timeline, San Francisco's task force or Economic Recovery Task Force began in late April, and so really began its work beginning in the month of May. One of the key things that we centered on was really to try to help create a way in which we can help facilitate a safer reopening for San Francisco. That was one of the identified key priority areas of the task force, and so we worked very hard to try to do some of that work. Some of the main things that have come from that is, number one, creating very clear information and guidance and making sure that we're doing as best as we can to create safe business practices. This is pretty important because I think, as you all can imagine, to the extent that we don't provide good and clear guidance, businesses will be unclear about the ways in which they need to keep their workers and their customers safe, and it does less than create confidence in terms of re-engaging the economy. So if we do want to have a strong economic reopening, we do have to have that interlinked very, very closely with health outcomes and those guidances. Through the task force, we've been able to work with the Department of Public Health to really create a clear path to provide feedback to DPH on the different guidances that they are planning to put out there. So for example, while something might sound like a very good thing to do from a public health perspective, it might be completely unworkable from a business perspective. And so we try to find a way to create and find the same health results, but also being able to meet the business's needs. A second area where we've worked very closly with DPH is also to provide feedback as they, and also to advocate to create a reopening roadmap. This was something that was put out in late May. This has since changed and is on pause at the moment. So we're going to be looking to revisit this with Department of Public Health. But the intent of this component was really to make sure that we provide as much forethinking and information about where the department and the city was going in terms of sequencing of different openings so that people can plan and prepare ahead. There was always an intention to be able to revisit this roadmap as we learn more information and as we continue to hear from industries about different ways in which we can open in a safer way. And then finally, one of the big things that we've heard in terms of facilitating a safe reopening is also to try to create more flexibility in how it is that we allow people to utilize spaces. I think you may have heard of the Shared Spaces program. This was launched not that long ago, but we've seen a huge level of interest from San Franciscans. We've had over 1,000 or so applications that have come in. You can see that most of them are for parking spaces or sidewalk spaces right in front of businesses, but there is a growing interest in being able to close down roadways in order to accommodate for more spaces. And so this program was really meant to kind of come together very quickly to make sure that we try to remove as much red tape and kind of typical processes as we normally would have to allow for that flexibility. We're learning a lot as we go, and I think the program is going to continue to iterate so that it becomes better, is easier to navigate through, and that hopefully makes it easier for businesses to take part in this. The next part of what the task force is going to be working on, and I'll go quickly through this, is just really to create those midterm and long-term policy ideas that really help to put San Francisco in a stronger place. And so while we know that COVID-19 is going to be with us for a period of time, we also know that we have to be planning for things that will help in the interim. So what can we be doing to support businesses through the cycles of potentially having resurgences of COVID-19 occur? On top of that, we also want to be thinking a little bit more long-term to say, what are those investments that we should be making at this point in time to help make sure that San Francisco's financial future, our economic future, is strong going forward. At a top level, these are some of the concepts that are emerging from the 4 policy groups. There is overlap currently amongst the different policy areas, and we're actually working very hard right now to consolidate that to make sure it's a comprehensive and integrated approach. But this is just some of the thinking around how to support businesses and different groups as we think about reopening. This is what we're thinking in terms of integrated priority areas. And so it focuses really, again, on these should not come as a surprise, supporting existing businesses and organizations, really supporting workers and connecting job seekers to opportunities very quickly and nimbly, helping to meet and protect the needs for a vulnerable population very immediately. So we're talking about something as simple and basic as making sure people have food to be able to sustain through this period of time. I think housing continues to be a big challenge. It was a challenge before COVID, and it continues to be now. Pursuing economic justice, and finally, really taking a look at the spaces that we have and the rules that govern them, and how it is that we could be either more flexible or think about using our spaces in a different manner. So I'll just stop there to say that the work of the task force is going to be wrapping up in terms of initial recommendations coming out in this month. That being said, the final report won't be complete until October. If folks have ideas or thoughts, feel free to continue to send that information to us. I'll share the link about where you can send an email or to complete a survey if you would like, so that you can make sure that you have a voice in this as well. But that being said, I think the one thing I will say is that the task force's work is focused really on this period of time. We know that the job of economic reopening, the job of economic recovery is a long-lasting one, and it will also evolve over time. And so I don't think that any of us believe that the work here is the end-all be-all. We actually believe that this is just a beginning place, and in fact, it's going to continue to iterate and change as we go forward. So with that, I'll stop the share and then move on to the next section.
Great. Thank you, Assessor Chu. And I believe we have Daniel here now. It sounds like Sam got kicked out for some reason. So Daniel, if you want to start off with questions. And I do want to say to everybody, we try to consolidate all of the questions, and we are going to get to as many of them as possible. If we do not get to your question, please email us at stephaniestaff@sfgov.org. And Assessor Chu will provide her information as well, but we want to make sure your questions get answered. So with that, Daniel, why don't you kick off the first question?
Sure, yeah, and hopefully Sam will be able to make it back on soon and rejoin us. But I'm happy to pick up from here in the age of Zoom. And first, I just wanted to thank you again, Assessor Chu, for that presentation. And I guess we'll just sort of jump right into some of the questions.
Absolutely.
Many of the folks who responded to the survey that we sent out had questions related to the state of the pandemic in San Francisco, generally speaking. And the first question we have is from Sherry in Pacific Heights, and she wants to know if COVID cases and deaths are rising.
Okay, sounds good. So I'm going to go back to sharing screen, and I think there were actually a number of questions related to the health status of the health and testing and so on. And so I thought I would probably just go through them, and then we can kind of answer other ones if they have come up. So, let's go. Here we go. So I think at a high level view, so far San Francisco has seen close to 8,000 cases in terms of COVID positive cases. There have been 67 deaths so far, and we've collected about 300,000 or so tests. I think what we've seen overall is that San Francisco's death rate is actually lower than in different parts of the country, certainly, and different parts of even the Bay Area. Very much because I think San Francisco was able to really, what they call, flatten the curve and not impact our health system in such a way that we weren't able to take care of the people who did really get sick and needed that intensive care. What I'm sharing here in front of you is a snapshot of where we are as of today in terms of the major health indicators that we're looking at. And so when you take a look at the first 3 items here, these are really indicators that speak to whether our healthcare system is adequately resourced to be able to address people who are getting sick. So some of the measures here are the rate of increased hospitalizations, the number of acute care beds that are available, and the number of ICU beds that are available. And you see here that in terms of where we are, we're in the green zone for a hospital care system. And so in terms of our capacity, it's looking like we're doing pretty good in terms of our ability to handle hospitalizations and folks who are getting really sick. The second portion, the next 2 indicators after that, really speaks to the disease situation in San Francisco. And so this is really speaking to the number of cases that we're seeing in San Francisco, as well as the number of tests that we're able to do a day. And these are interlinked, because if we're not doing tests, then we're not actually seeing how many positive COVID cases there are. We are, in terms of the number of new cases, we're in the red zone. And so you see here, it's at 10.6. I will say that this number, the 10.6, is actually an indicator from August the 6th. And the reason that that is not today's information is because with some of the state reporting challenges, this is sort of the latest information that we've been able to get on the public website from DPH with regards to the number of new cases. But that being said, the number is not good there at that 10.6 number. In terms of the number of tests per day, this is also a number from the 6th, August the 6th. But you can see that we are in the green zone there. We are well above our targeted level of 1,800 or so. I think that there is a desire from the Department of Public Health to see that number go up. And so I think they may try to change the goal of how many tests we do over time. And then finally, in terms of the disease control scenario, this is really speaking to, once we find out that someone has COVID-19 or test positive, are we able to reach them so that we're able to do contact tracing and know who it is that they got, they might have been exposed, who might have been exposed through contact with them. And not only that, but we also want to know whether or not we have enough personal protective equipment to be able to protect our healthcare workers. So you're seeing there that in terms of contact tracing, we're in the orange zone. It's not a good place to be. We want to really get to meeting our goals of 90%. We're currently at the 74 and 77% level in terms of being able to reach those individuals. 74% speaks to the people who are actually testing COVID-19 positive, and then the 77% are the folks that they said that they were in contact with. So were we able to reach those people that they said they were in contact with? I like to show this because it really shows you the trajectory of hospitalization in San Francisco since we entered into shelter in place. And so you see on this timeline here that there's a marker that says March 17th. That's when shelter in place happened. You can see that in the spring, we spiked at roughly about 94 hospitalizations. And then since that time, you've seen that our numbers have kind of come down in terms of the number of hospitalizations. And then roughly at the end of June or so, we started to rise again in terms of the number of hospitalizations. These stars that you're seeing show up on the screen, they speak to the different reopenings that we've actually done in San Francisco. So you can see that we opened some activity in the middle of May. We opened activity in early June and in mid-June roughly. And so these reopenings were all happening locally at the same time that we started to see hospitalization counts go down, and that trajectory continued to happen. As you probably know, San Francisco was slated to open up our next tranche of businesses that included personal services like barbershops, so nail salons, and so on, museums, and other activities. On June 29, we were not able to open up those activities because on June 26, the San Francisco health officer created, or basically put a pause on opening right in advance of that June 29th date. And you can see here why some of the information was concerning. They started to see a rise in hospitalizations. And I think they really wanted to make sure that we weren't opening up additional sectors at exactly the same time that we were seeing an alarming increase in the number of hospitalizations that we're seeing for COVID-19. Soon thereafter, but actually quite some time after, when you think about the spread of the disease, on July 17th, the state put us on what they call the state's watch list. And so that meant that essentially we weren't able to open up additional activities thereafter. And then finally, in terms of the positive COVID case counts, this is just showing you graphically where those cases are prevalent. And so again, in the northeast sector, as well as the southeast sector, is where you're seeing the predominant concentrations of COVID positive cases. So this is just kind of showing you where the prevalence is. Hopefully that answers some of the questions that came through in terms of where the disease situation is. I think right now, in terms of the reproduction rate, you know, in the beginning, very, very beginning, before shelter in place was put into place, our reproductive rate was somewhere in the range of 3. Over time, especially after shelter in place happened and the businesses and everything started to close and people really started to take precautions, we saw that reproductive rate number go down, I think as low as roughly about in the 0.8 percentile, so 0.84-ish, in that kind of range. And that was sort of sustained for a period of time. When we saw this latest resurgence, that reproductive number went up to roughly 1.3 or so. And that's not good. I think if there is any number that is above 1, it starts to show spread of the disease. If it's below 1, it actually starts to show kind of the diminishing of the disease. Right now, we think that we're somewhere right below 1. So we think that San Francisco is about 0.9 something in terms of the effective reproductive rate. And I think that is just to say that when we say this number, it's not an exact number. It is a projection that is based on hospitalization rates. And so we work with researchers at UC Berkeley to really come up with a model that essentially is showing what do we think the reproductive rate number is based on hospitalizations. Now, that reproductive number is going to be lagging by 2 weeks because as folks know, hospitalization data is 2 weeks behind in terms of progression of the disease and when people contract it and when it is they may start to see symptoms and need medical care. And so I think that the numbers are promising in terms of where we are with the reproductive rate, but it's really right below 1. And so we're watching very carefully on that. Hopefully that answers some of the questions that have come through.
Yeah, thank you, Assessor Chu. And hopefully you all can't hear my dog barking in the background, another Zoom issue. I just wanted to add really quick, you know, what your charts show, I think, is how we are paying painstaking detail to science, data, and facts to make all of these decisions to save as many lives as possible. And it is true, and I think a lot of people read last week, that there is underreporting right now in California because there was issues with the state labs. So some of the cases are underreported right now, but we do know, as Carmen said, in San Francisco, we have a very low rate of transmission up until about Memorial Day, really, and then that's when cases began to surge. And we're still currently in the midst of that surge, which is why we want to tell everyone over and over again, you have to wear a mask when you're outside your home. You have to limit going out as much as possible. And most important, what we're seeing is that a lot of this is spread from indoor gatherings and indoor activities. That's where we're hearing from the healthcare experts and all of these charts that you're seeing, that's where the disease is spreading from indoor contact. And I wanted to point out one more thing, and I know we need to get to other issues, but I think it's important to point out that San Francisco has been the best performing major city in the United States. And in the most recent data that I saw, we had the second lowest per capita rate of transmission, and we have by far the lowest death rate. And I'm not saying pat ourselves on the back, because one death is too many, but all of this, everything, all the decisions we're making at the executive and at the legislative level and through our economic recovery task force are based on trying to save as many lives as possible and based on all this data. So also one other thing, we had early intervention in protecting our nursing homes, which a lot of other cities didn't, and our hospital workers, and expanding hospital capacity.
Absolutely.
So we'll move on, and I'm going to try to get the dog to stop barking. So excuse me, Carmen, I think you're going to take the next.
Yeah.
Thank you, Supervisor and Assessor. The next topic that we're hoping to move on to is homelessness. Homelessness was the most referenced topic in our survey, accounting for just over a quarter of the questions we received. These two are sort of broadly representative of what we heard, and mostly they were directed at Supervisor Stefani, but of course, Assessor, we'd love to hear your thoughts too. So Luciana on Lake Street asked, I would like to learn more about short-term and long-term plans for homelessness in San Francisco. And Frederick from the Marina asked, would you please address the problems and solutions to homelessness in the Marina and all throughout the city? Thanks.
I can jump in I can jump in really quick. Sorry about that. The mayor's homeless recovery plan, basically the goal is to make sure that all those homeless residents that are in shelter in place hotels right now aren't just merely released back to the streets. And she's doing that by making sure that we have new permanent supportive housing, maintaining the safe sleeping sites as we have, and also reactivating some of the spaces in the shelter system and opening that up to a safe capacity pursuant to COVID-19 modifications that are necessary. As of July 2020, San Francisco has approximately 8,000 units of permanent supportive housing that provide permanent homes to about 10,000 residents, really. And the proposed homeless recovery plan will include 1,500 new units of permanent supportive housing over the next 2 years, which is really the largest expansion of permanent supportive housing in San Francisco in 20 years. We also plan to reactivate our shelter system up to 1,000 beds. This will make sure that we can house people in our shelter system once again, of course, at safe rates. So I don't know if you have anything else to add. I know that we have a transitional age youth navigation center coming online soon, the fall of this year, and then also in 2021 in January, we expect to open another navigation center in Bayview. So there are plans in place to make sure that we are not going to spill, make sure that we don't create more of a problem than we already have, and to make sure that we increase our permanent supportive housing to address those that are in our shelter-in-place hotels right now.
Yeah, and I guess I think that was pretty complete, so I don't have too much to add. I think from the perspective of the Economic Recovery Task Force, the street conditions and street cleanliness and the safety of streets continue to be topics that arise in terms of economic recovery. And so I think that there is a sentiment, and this was actually a sentiment that I would say was existing even before COVID-19, which, a lot of our convention businesses and some of the folks in terms of our tourist industry and our hotels were also saying too, is that San Francisco was beginning to lose business to other places in terms of people who are willing to come to San Francisco to visit, and that was already having an impact in our economy. And so I think that the idea about if we're going to do things like make sure that San Francisco continues to be a destination where people feel safe and welcome, if we're going to continue to support business activity, especially on like the shared spaces program that contemplates using street spaces, we're going to really have to think about how it is that we address street cleanliness and street behavior. It's not an easy issue. I think if it was, it would be done, right? Because we've heard so much about this, but I think that there is a lot of challenges that we do have to navigate through. That includes not only the housing challenge that is big, but also mental health, substance abuse, and other things that are really driving some of what we're seeing on the streets too.
Right, and I have more on that later. I think there's another question coming up about that I'll expand upon as well.
Yeah, you're right, Supervisor. Thank you. Next up, we're going to move to small business and reopening. We received several questions from individuals worried about when they could open their specific types of businesses. So I guess we can just go through those one by one. For example, Tracy in Cow Hollow asked, when are salons reopening and what's the next step for unemployment for workers? Our businesses are closed with zero income coming in. Wine bars and bars that serve food look like they're having parties every weekend, yet businesses like ours cannot generate any money. Assessor, I think you're on mute.
Sorry, yeah, gets me every time. Do you want to go through the other ones as well so that if they're similar, then we can answer them together?
Sure, yeah, there's 3 questions that we were going to go over in this category. The next one was from Trent, also from Cow Hollow. He asked, what's the basis for continuing to keep small gyms closed when the state's guidance on masks, sanitizing, and distancing in fitness facilities could prevent the spread? These gyms are critical to the community's health and a key part of our neighborhoods. And the final question in this category was sort of a long one, but Assessor Chu, you touched on a couple of these topics before. It's from Susan in Jordan Park, and she wrote, the tax base of the city seems to be leaving. Conventions and tourists were gone before shelter in place due to the homelessness crisis. Young people with remote work are putting their things in storage, living and working in places where rent is lower. Many homes have come on the market for sale, especially in District 2, and folks seem to be moving to Marin or out of state even. Second homeowners are turning their second or vacation homes outside of San Francisco into their primary residences. Shelter in place has lasted longer than anyone imagined, and small businesses are folding, some never to return. So what does San Francisco plan to do to get the economy moving and growing again? How long do you expect it to take? And how do you propose to fund the city budget in light of these changes? So I think you both probably have some thoughts on each of those questions, and we can go through them.
Sure. So I can start off with, because I think it's important to understand the interplay between what decisions we have the ability to make here locally and also what is being driven by the state, because I think there is a fair amount of confusion that exists about what people are seeing happen in other counties, what people are seeing and hearing from the state, and then what's happening here locally. And so I think it makes a lot of sense to try to clear some of that up and then also talk about the approach. I think in terms of small businesses, you know, sitting on the Economic Recovery Task Force, our job is to try to make sure that we do the best that we can to try to help support our businesses. And so we're hearing from our local businesses all the time about the challenges that they're facing, about the real economic stresses that they're facing. I mean, people are taking out loans, they're mortgaging their homes. If they have that, you know, some folks can't even make the mortgage. And so we're talking about real, when we make the decisions at public health to open or not to open industries, there needs to be an awareness, I think, from the city side, and we are certainly sharing that those decisions have a real impact on people's financial and livelihoods. And so I think that's something that we continue to press upon our public health department to say, there's a balance on making sure that we have the health outcomes that we want, and we need to balance all of that in line with also just economic survivability and people just being able to make it. I think the other thing that there is also a recognition on is that we keep on talking about economic reopening and measuring and balancing health, but the truth is that there's also other impacts to the economy and to people with not being able to engage the way that they used to, right? And we're talking about social isolation for many of our seniors and elderly, and that's problematic. There's a lot of mental health challenges that we're seeing out there associated with it. And not only that, especially for some of our kids who have been able to kind of go through our public school systems or our school systems, that was always a way to be able to do wellness checks also on families and how people are doing, especially if they were going through different economic stressors. And now that avenue is not even open. So I think there's a lot of awareness about some of the challenges, domestic violence and other things that exist without having kind of like a reopen economy and ways in which people are engaging and seeing each other, right? And so that being said, let me walk through some of the ways in which the state kind of impacts how it is that we're able to make decisions. So in terms of the state direction on what we can reopen, I think the way to think about it is that the state basically says, here is the list of things that local jurisdictions across the state can open. They basically say, here's a list of things of what cannot open. And then they say for variance counties, which San Francisco as of June 25th had become a variance county, here are the additional things that you could open. What has complicated that is that because we saw the recent resurgence in terms of the bad health outcomes in our local jurisdictions, we got put on California's watch list. And what the state has said is, if you are on our watch list for 3 consecutive days, we also have additional requirements of you, which means that you cannot further reopen. And not only that, but if you had opened certain things indoors, you've got to close them. And that list of activities that I show here in red are actually those activities that the state has said, if you're on our watch list and you had allowed them to open indoors, shut them all down. So I just want to be clear that we are really driven by what the state is saying we can open, what we cannot open, and if we're on the watch list, here's additional things you cannot do. I highlighted in yellow here 2 of the areas where we had to actually roll back our openings. For the most part, San Francisco was taking a very measured approach. We were constantly looking at, when we do open different activities, what the health outcome was and whether there was any concern associated before moving to the next phase. I think because of that, we operated and moved cautiously, and we didn't have that much to roll back when it came time to, when we became part of the watch list. And so the things that did roll back was shopping centers or malls. So you saw that places like Stonestown or the West or the downtown shopping centers were closed. Not only that, but a non-essential office work, we had started to open up allowance for that. That actually had to roll back to doing remote work. So who is on the state watch list? You can see here a list of counties that are on that state watch list currently. All of the ones that are highlighted in blue are the ones that are in the Bay Area. So right now, all 9 Bay Area counties are on the state watch list. So we are all on the same boat in terms of not being able to open a few things. I thought I'd share this with you because here are the watch list criteria for landing on this list for the state. They really speak to whether you're doing enough testing, whether you're seeing an alarming increase in terms of cases or hospitalizations, whether you have hospital capacity or ventilator capacity. So that's what is driving whether we are on the watch list or not. Again, as I mentioned, the consequences of that is that we have to pause all further reopenings. So even if we had wanted to open additional businesses, the state is requiring that we don't. Not only that, as I mentioned before, they list out specific industries where if we had allowed for indoor activities to happen, we have to shut those down. And finally, recently there was a recent development where the state had said education can't start except for elementary schools, where if you have a site-specific approval from your local health officer in conjunction with the state, you're able to open. And so I just want to share that information with you because it's really important to understand that as much as San Francisco may want to open different things, part of being on the watch list means that we can't open anything else. Just recall that on June 29, we were planning to open personal services. So that included nail salons, barbershops, it included estheticians, and a number of other businesses. It included also indoor museums. It included the zoo. The zoo was able to open because it was outdoors. And the state was, or the local jurisdiction was beginning to look at fitness centers and gyms and saying, how could we do this in a safe way as well? But as I mentioned, we landed on the state watch list pretty quickly. And so we're not able to open additional things. Just graphically, this is the way to look at it. So again, the state is opening up in 4 different phases with lower risk activities first, and then moving on to higher risk activities. We're currently in stage 2. As I mentioned, if you're a variance county, you get to open up additional things. The way San Francisco is approaching that is that we're taking a look at all of the activities that we're able to open. We're opening them up in incremental tranches so that we're able to see the impact of that on the health outcomes. And as I mentioned, we open on the 17th of mid-May, in early June, mid-June. And then we had a local pause based on our local health indications in terms of hospitalizations. And then San Francisco got put on the state watch list on the 17th. And so we have had to pause everything as we speak. And so I think that is sort of the explanation a bit about that state and local kind of connection. In terms of where we're going next, one of the things that we are constantly looking for now is what the state direction is going to be. And so we have to first come off of this watch list. We haven't heard of any indications of San Francisco coming off just yet. So we'll see. And I think it's also going to be mucked up a little bit in terms of the state reporting challenges that they have. I'm sure that they're going to want to make sure that that gets under control before they make any changes with what are watch list counties and what are not, or which counties are not. On top of that, there is indication that the state may want to provide additional requirements for when you do come off of watch list. And we don't know what those things are yet. And so we're going to be watching that very closely before we can actually open additional things up. We're going to be speaking with our health officers to really say, how are you thinking about things? I think primarily the thing to know is that, again, they really see outdoor activities as being less risky than indoor activities. Anything where you're taking off a mask is going to be more risky compared to things that where you can keep your mask on, and anything where there is very extreme exhalations, where like wind instruments, where you're singing or things like that, where the respiratory track is really utilized and you're kind of putting a lot out. Those are things that are going to be more risky activities. And the last thing I'll say is also where different households are mixing, that of course is a higher risk activity as well. And so I think those are some of the things that are going to be considerations for the health officer as they think about what the next stages for reopening will be. In my mind, we really want to impress upon the health officer that this is not a zero-sum game, right? We don't want to see the economy fail as a result of health. And I don't think that that is the perspective of the health officer. What we're trying to do is to say, look, there's all of these activities that are happening. We did see a resurgence, but a lot of things were happening at the same time, right? At the same time that we were opening up economic activity, people were beginning to get a little bit looser in terms of their interactions with friends and other things. And so I think if we're going to be able to sustain an economic reopening, we're going to really have to double down on the things that Supervisor Stefani mentioned earlier: social distancing, wearing masks, those kinds of things. Those are going to be really helpful for us being able to sustain opening going forward. And I'll stop there.
Thank you so much, Assessor Chu. This is just such good information. And, you know, I just want to just add a few things, especially into to Tracy in Cow Hollow. I think I know who that is in terms of her salon. It's on Filbert and Fillmore. So when you can go back to the salon, please go see Tracy. It just breaks my heart, you know, that businesses are having to sustain these losses. And, you know, I think you stated very well, Assessor Chu, the state watch list issue and that balancing issue we're having in terms of, you know, protecting lives. And then also, you're also protecting lives by opening businesses and let people work. It's just that balance of when do you open, when do you not? And, you know, I just want to share a quick story. I was in Merced recently. My dad has Lewy body dementia, and I got a call that he had a fever and they were rushing him to the hospital. And I ran down. I didn't run down there. I drove down there, and I was actually in the hospital with him in the ER, and I had to put on this whole gown and this whole thing. And it was pretty scary, you know, watching people in the emergency room just lined up in the hallways on gurneys. And yes, this is Merced, but this is what we don't want to have happen to our hospitals. And, you know, there was one man lying on a stretcher, and he just looked so scared to me, and it frightened me. And I have a sister who's a nurse at UCD in Sacramento at Davis, and then a sister who's a respiratory therapist in Atlanta, Georgia, which is really bad. And the horror stories they tell me, you know, it's like those stories, and then I hear Tracy's story, and it's just like you want to be able to help everybody. And the way that we do that is do what they're telling us to do. Wear a mask, because we have to get this under control. And it's on all of us to make sure that we do, because we have to be able to open up, you know, as quickly as possible. And not just salons, like I think it was Trent mentioned gyms. I love gyms. I think a lot of people know that. And I have been working with gym owners and our parks department to reduce fees for outdoor exercise and personal training. We know those fees have been cumbersome, so we're really trying to find ways that people can start providing that activity outdoors and trying to cut fees and things like that. So, we are trying to find ways with all of the science, data, and facts that you've just presented, all the rules that, come with being on the state watch list, and trying to get people to wear a mask, everything. It's just like, I feel like we're, just trying to balance it all and trying to help. We want to help everybody. We want to make sure there's no deaths. We want to open businesses. And so we all have to play our part in really trying to make sure that we get off that watch list and avoid, really, they say the spread is in the indoors more than the outdoors. That's what they're telling us anyway. So I think that's all I have to add on that.
Yeah, thank you. I think that all, the topic of the economic recovery transitions nicely into the next topic that some folks asked about, which is the city budget. So several respondents had questions about the state of our budget this year. Hartmut from Townhall asked, what's the currently projected budget situation for San Francisco? And what are the priorities as cuts that will inevitably have to take place? So maybe Supervisor Stefani, you want to start, and then we'll hear from the Assessor Chu.
Sure. Yeah, thank you for that question. I'm not serving on the budget committee right now, but I do follow it very closely. And right now we are facing a $1.7 billion budget shortfall over the next 2 years. And what that means, if we want to maintain the exact level of services we have now, we would need $1.2 billion more. And obviously that's a large sum of money. The mayor issued budget instructions to all department heads to cut their budgets by 10%. It's important to note that the deficit doesn't have an even impact because tourism obviously is down. It's going to be down for a while, and a lot of our general fund revenue depends on hotel taxes and sales taxes. And so that is going to be a problem going forward until we get this pandemic under control. Also, COVID is costing a lot of money too, and it's like COVID attacks our budget from both sides. On the one hand, it increases the expenses we incur by trying to take care of so many different issues that keep popping up, and it decreases our revenue because we don't have tourism, and for obvious reasons you all know. So we need to be laser focused on what we're doing with our budget this year and making investments, I think, that actually prioritize the basics, right, and really gets it right. There's a lot of things that can be cut in the budget, and we need to make sure that when we are looking at the budget this year, we are making sure that, like I said, we're covering the basics and holding a lot of people accountable in terms of how previous funds were spent. I don't know, Assessor Chu, if you want to add on to that.
Sure. I think you nailed it in terms of the challenges that we have, and I think our hotel tax revenue is something like 20% of what we were last year. So I think that kind of tells you the scale in terms of like in the number of employments. So people coming through SFO, I think it's down 90%. So it's pretty serious in terms of the revenue challenges and generally economic challenges that we have associated with this. And so I think our budget is going to reflect that. So, when the economy hurts, I think all of us are hurting personally, but also as a government as well. Yeah.
And those budget hearings are taking place now, so you can always tune in if you want to, or check in with our office to see how they're going. I know tomorrow, I believe that they're discussing the police department's budget, and it's the first time. Usually these budgets come up twice, and tomorrow will be the first time the budget committee will be discussing the police budget. And as you know, that'll be a different discussion than it's been in previous years.
Yeah. I should probably add that I think with anything, we're always going to be impacted by what happens at the state level as well. And so federal and state impacts will roll down to our local jurisdiction. So the state is also suffering from a deficit. And so they're probably going to make cuts that are going to impact us going forward. Likewise, if the federal government decides to pass additional funding to help support local jurisdictions, that will help, or transportation. And so we'll have to see kind of where all of those things go. There are a number of ballot initiatives that seek to influence sort of revenue. And so I think locally here, there's a CEO tax, there's a business tax, I think there's a transfer tax that is on the ballot. There's a GO bond that's on the ballot for recovery. On the statewide level, there's actually 2 ballot measures that impact property taxes. So watch out for that. Proposition 15, which is called split roll. And then the other one is Proposition 19, which would impact the ability to pass on your base year or your Prop 13 value to children, to grandchildren, and also if you're a senior, to be able to retain that when you have a replacement home.
Right. I think that's good to point out too. I mean, it's so interconnected between the federal, state, and local level, and we are really depending on FEMA money to reimburse us for at least 75% of our COVID incurred costs. So if we don't get that money, we're going to be even in a worse position. So hopefully we do, or we'll have to figure, more things will have to be cut.
Okay, so those were some of the biggest and most common questions that we got. We just have a few remaining. Hopefully we'll get to all of them. So next up is transportation. Anna Marie in Pacific Heights and Anne in Calhalla both asked about the restoration of transportation. So Assessor Chu, could you please give a brief update on the transportation recovery plan?
Sure. So the Transportation Recovery Plan is actually happening a little bit outside of the Economic Recovery Task Force, but I could speak to general points. And so Jeff Tumlin, who is the MTA director, is sort of leading that charge. The way that the recovery plan works essentially is that when shelter in place went into place, and then you saw such a huge drop off in terms of ridership, they ended up really cutting back in terms of service and so on, and had really a bare bones kind of operations going. The way that the Transportation Recovery Plan works is that they anticipate kind of different phases of opening of the economy and different needs going forward. And then their plan is to scale up their services as they go. Currently, about 20% of the MTA's operations is fare box revenue. So that means that 20% of the revenues they depend on come from people who pay the fares to ride Muni. And so you can imagine the significant drop off in revenue that we've had in terms of the COVID-19 situation. I think on top of that, what you're also seeing is because of the social distancing that is required, what it has essentially meant for operations is that now the buses that we have or the trains that we have can really just carry 1/3 of the capacity that we used to be able to. So 2/3 of the service cut, it essentially feels like a 2/3 service cut in terms of capacity. The MTA currently has a $200 million budget deficit that they are facing in the current year. They were actually able to move forward this year without layoffs by having the use of the reserves and being able to depend on the CARES Act funding. So the CARES Act did include some funding for to shore up transportation systems, which has been helpful for them. But it doesn't mean it's going to sustain them for the long run. I think for this year, they're probably okay, but going forward, there's going to be challenges. I'm not sure what it means for restoration of specific lines just yet, but we can definitely put you in touch with the MTA folks.
And I do with regard to the 45, because we did get a question about that. The 45 goes right in front of my house. It is going to be restored. I believe the full route will be restored beginning Saturday, August 22nd. So I know we got a question about the 45. So if you have any other questions about any other routes, just email us and we'll let you know.
Yeah, thank you. So circling back to homelessness for a moment, we received several questions about the COVID-19 response program, where homeless individuals are temporarily housed in hotels across the city. Priscilla from the Marina asked about that issue. What's going to happen once the leases for hotels on Lombard Street, now being used as housing for homeless individuals, expire? Some at the state level want to use federal funds to purchase hotels for housing for the homeless permanently. Do you think this is a good idea, Supervisor?
First of all, thank you, Priscilla, for that question. I think it's really important given the fact that we do have 3 of these hotels on Lombard or in the Marina. And really, there has been some misinformation about these hotels, so I'm glad you've asked the question and we have an opportunity to at least clear that information up. Right now, there's only 3 in the Marina that are engaged in the city's program of shelter in place. And I've seen reporting that alleged the number was more than 10, which is not true. You were referring to hotels being housed for the homeless permanently. The governor recently made $600 million available to purchase hotels, and turn them into permanent supportive housing. And that $600 million is for statewide. And my understanding is that only one hotel in San Francisco has actually applied for this funding, and it wasn't in District 2. And I recently read an article that this funding is not all that easy to get. It comes with a lot of conditions in terms of ADA, making sure that the hotels and motels are up to certain standards, meeting certain timelines in terms of financing. So it's not an easy thing. And first of all, the money, $600 million, when you're thinking the entire state, it doesn't cover that much. And we've been allocated, I believe, around 100 million. And that, again, doesn't go that far, and especially with all the conditions on the motels and hotels. I think it's going to be really a hard program to effectuate. But like I said, so far we haven't heard of any. We know it's one in San Francisco, and that one's not in District 2. You know, my goal, as I said, remains to help us return to normal as soon as we possibly can. And I believe our local hotel operators want that as well in terms of getting back to business, and that's tourism. So they are critical to our infrastructure. They are critical to our economy. And so we are trying to make sure that we preserve those motels and hotels for that purpose. So we will keep you posted on that. And I also want to let everyone know too that I've applied to be what's called a DSW worker, a disaster service worker in one of these motels on Lombard. And I'm awaiting my assignment where I will go work there for a few weeks or so, either a few weeks or a month. So I can see for myself really what is happening, because we all know different things that have been reported, very disturbing things. And, you know, I live on Greenwich, you know, right around the corner from one of them. And I want to make sure, I want to see for myself. So I'm awaiting my assignment, and I will keep you all posted on what that looks like. But so that's pretty much where we're at with the hotel motel situation around the homeless. Is there anything you wanted to add, Assessor Chu? Okay.
Okay, so we've reached our final question for tonight's conversation. Assessor Chu, you can start. Annette from Pacific Heights asks, what are your top priorities for District 2 or for the assessor of San Francisco, given the times we live in? It seems also that many people are leaving San Francisco, given the moving vans that we see on a lot of our streets. And can you comment on that as well?
Sure. So I think I'll speak more broadly. I think, you know, two things. I wear two hats right now, one as assessor and then one as working on the Economic Recovery Task Force. I think in terms of the assessor work, we just really want to make sure we continue to run the most efficient organization we can and prioritize customer service. And so we're going to continue to do that. And we've been able to really make big strides in terms of improving our technology and getting things in order. I mean, we were able to go from, you know, working all in office to remote work, 98% of our hours remote work the next day. So I think we really picked up in a big way, and I'm very proud of my team for doing that. That doesn't mean that we're perfect. We have many things we have to continue to improve upon. But I think what is bigger in my mind right now is how we get the economy going back again. And that's really where my priority and my head is at in terms of where I spend a lot of my energy. And I think, you know, I think about kind of all the mixture of things that have to happen. And I think it kind of boils down to a few things. I think the city has to do a stronger job when it comes to encouraging the right social behaviors to allow us to be able to have room to open. And I think, again, this whole message around social distancing and masking is so important, because if we don't really take that seriously, we're not going to be able to open up more. And I don't want to see that happen for our businesses, for our residents who really are really struggling and really need to get back to work and really get going again. And so to me, it's really important that the city does better in terms of that, and that we continue to ready our health systems to respond and to build confidence, because ultimately people are not going to engage in the economy, and they are not going to come visit San Francisco unless they feel confident that we're taking the health outcomes seriously and that we're providing clear guidance for how things should be and that we're serious about it. And my goal is that we become the safest place for people to live and to visit. And I think that message is going to be really helpful for getting our economy going again. I think we have to really focus on making sure that we continue to financially support our businesses and our residents, and that we create as much flexibility as we can and try to break down the things that have been barriers in the past. And then I think finally, in terms of economic recovery, it is for the long haul. This is not something where the Recovery Task Force kind of provides recommendations right now and we go away, because when you talk about recovery, we're going to be going through ups and downs together, where the disease is going to come, it's going to go, and hopefully we can keep on managing it so that we can continue to open and have steady openings happen and sustain those openings. But we also need to be thinking about San Francisco's future and saying, what kind of a city do we want to be in the future? And can we start building that and showing people the way so that people know you can rely on San Francisco to be a leader, to be the place that people want to be. And I think that, everything is so changing and so dynamic now, where people are even saying, do I need to even come to San Francisco to work anymore? And that's not what we want, right? We want people to still say that I want to work here, I want to live here. This is an amazing city to visit and to be part of. And so I think we need to be thinking big picture about that.
Thank you for that, Assessor Chu. And yeah, I agree. Of course, our priorities are public health and economic recovery. And just touching on, the economic recovery, another, situation, of course, is the homeless issue. And that's a top priority of mine. And, one point they said, oh, hair salons can open outside. And, which was a very confusing thing to say. And then, a lot of said, well, maybe even if that made sense, I can't because of what's happening out on our streets, which is someone is there clearly with an issue that needs to be taken care of, and it's not easy. And so we have to address our homeless crisis. And for me, it's really with a particular attention paid to substance abuse. For me, it's an issue that I think we're missing the mark on entirely. I feel like a lot of our policies, and I think that this pandemic has really revealed and shined a light on, more so than we already knew before, I think, is that there is a lot of enabling in our policies, in my opinion, and that we have to create more paths to recovery and not support addiction out on our streets with open drug dealing. And it makes it too easy. And it's not just that it's unfair to those that are housed like the Tenderloin and Hastings, they sued the city. It's unfair to the addict and the alcoholic who's on the street maybe trying to get well when you make it so easy for them to get drugs and not create a path to recovery. I remember talking to one person who's now sober and in recovery. He said, yeah, when I was out on the street homeless in the Tenderloin, I was housed and my addiction took me into the Tenderloin. He was addicted to heroin. And he said, never once when I was being offered needles was I offered recovery. So for me, it's there has to be a shift in how we look at how we're treating substance abuse and among the homeless population. And another thing that I saw, and what drives that point home for me, is this idea that somehow by holding people that are addicted, whether it be alcohol, drugs, whatever, and of course there's a lot of people that are suffering from that and mental illness, but if we don't provide paths for recovery, we are doing something wrong. We cannot just continue to enable the behavior. And it's not that when you expect people to behave better that you're stigmatizing them, because I hear a lot that, well, you don't want to stigmatize drug abuse, you don't want to stigmatize alcoholism. And that sounded like I saw an email after the meth hotel, lab in the hotel and all of that, someone said that they didn't like the narrative that stigmatizes and perpetuates the idea that people who use drugs are dangerous to everyone around them. Well, here's the deal. People that use drugs often are dangerous to the people around them. And it's okay to say that because that's the reality. And we have to look at that. That doesn't mean that you stigmatize the drug addict or the alcoholic and say they're bad because of that. And I mean, the fact that they suffer from addiction in the first place is something that they're going to have to battle the rest of their lives. But we also have to hold the behavior accountable. When someone gets behind the car and gets behind the wheel and they've been drinking too much, we hold them accountable. When someone is on methamphetamine and terrorizing people on the streets with the behavior, we hold people accountable. And that's okay, because people will never get well if we continue to enable and say, don't stigmatize because people that use drugs aren't dangerous. That's not the truth. And I think we need to tell the truth. And I think we need to look at our policies, take a hard look. Harm reduction is one thing, but at the same time, we have to create paths to recovery. We have to hold people accountable. And, it's almost just the tough love theory in terms of how do we really address this problem with people who are struggling with this addiction on our streets. We're not getting it, we're missing the mark, and we have to change our policies to make sure that we get more people into recovery so they can live better lives and so that our businesses can thrive and all of us can thrive. So hopefully I am doing a lot of work on that in terms of people in recovery having a voice at the table too, because one more thing, this is not to get on my soapbox or anything, but this is a thing, as you know, that's extremely important to me. A lot of times people who are in recovery, and I see this a lot when I'm talking to people about what works, what worked for you. And they say, well, you know, I've told people, you know, in public policy positions that abstinence actually worked for me, and that I want to seat at a table so I can explain that path to recovery. And a lot of times those people are shamed and, you know, to thinking, well, that we don't want that to be, you know, that's not the only path. Well, maybe it's not the only path, but those people that have recovered have to have a seat at the table. And it's my intention to make sure that they do. So that's one thing that I'm very focused on. And the other I wanted to talk about really quick, because it's in the news, it's been in the news a lot, is corruption in City Hall, which really, again, gets under my skin because, you know, when one public servant abuses the trust of the public, it hurts everybody. And it angers me so deeply that someone would take taxpayer dollars, enrich himself, and then create this feeling of government doesn't work for me. It's not a way, it's just, it really angers me. So like I said, we've all been disturbed by serious legal and ethical allegations against our Director of Public Works, our old Director of Public Works, and the Director of the Department of Building Inspection. So what did I do? I looked at how did they get away with this? What did they actually do? We reviewed the controller's audit to understand what happened, because I was a department head for 2 years. I could not wrap my brain around, I did contracts, I did RFPs. I'm like, how did they actually get away with this? So I recently introduced what's called the No Graft Act to close those contracting loopholes that those directors used in order to enrich their friends in exchange for bribes, and I should say allegedly. And later this month, I'm also introducing sweeping new reforms to the way grants are awarded. And my office just recently reviewed a draft of the legislation, and it should be ready for introduction soon. And I'll be thrilled to share that with you once we introduce it. I also recently resigned, you may have read about this in the paper, from my seat on the Behavioral Health Commission after blowing the whistle on some very serious issues with their contract administration. And that investigation has expanded into the potential misuse of a PPP loan. And I will be introducing legislation to reform the Behavioral Health Commission as well this month. And I'm really proud of my anti-corruption work, and of course my staff who's helping making it possible. It's painstaking and it takes a lot of time, but I absolutely believe elected officials have to be held to the highest accountability. And like I said, when one messes up, it really impairs the trust for all of us, and it can't happen, it can't continue. So those are the things that I'm focused on. I'm focused on, of course, all the constituent issues that come in. I know we are in really difficult times, and I always say to people, it's okay not to be okay. And what we didn't get to was the fact that domestic violence is skyrocketing. Suicides have been off the charts. I've in District 2 even, I get the reports from Chief Nicholson, and I just want everyone to know that if you're not okay and you need help, or you know someone who's not okay and needs help, please let us know. We want to be of service. We want to help in any way we can. I know people are struggling. I know that we can't make everybody happy as we combat this this pandemic, on the health front, on the economic front, but we want to try, and we really want to be there for you. And like I said, I want to thank my staff too, Sam, Daniel, Andy, and Frankie, who are just wonderful. I'm sure a lot of you have interacted with them, and please don't hesitate to contact us for any issue you may have. I don't know if there's other questions, Sam, or?
That's it for the questions, but we'd be happy to hear closing remarks from the assessor too.
I think that the supervisor did an amazing job closing it out with that point, because I do think that the pandemic is really tough on people. People are going through a lot of different stresses, and in many ways, people are very isolated right now too. And so I do hope that if you are struggling, or if you do know someone who is, that you'll reach out and know that people do care. So I couldn't say that any better. It's so important right now to support one another.
Right. Well, thank you, Assessor Chu. You know how much I love you. I really, you're wonderful. We're so lucky that you're leading our city and the Economic Recovery Task Force. I know we're in good hands with you. So thank you for being with us tonight. We'll make sure everybody gets those charts. And with that, good night to everyone, and please stay safe and healthy. And of course, wear a mask when you're outside.
Thank you, Supervisor.
Thank you.